And sticking with the global pandemic, CGTN's global business news anchor, Rachelle Akuffo, recently spoke with Dr. William Moss, a professor from the Bloomberg School of Public Health at Johns Hopkins. He's also executive director of the International Vaccine Access Center. She began by asking if the global community has turned the corner on the coronavirus pandemic.
We're still very much in the thick of it as a global community. We're still seeing very high numbers of cases, numbers of hospitalizations, numbers of deaths, particularly in some of the hotspots around the world right now, India, Nepal, certain countries in South America. So we still have a long way to go to get out of this global pandemic.
And certainly it seems some countries are breathing a sigh of relief as they're able to get the pandemic in their countries under control. But we did see that earlier this month, the organization did publish its overall assessment of the world's response to the pandemic. What has actually worked and gone well so far?
Yeah, so you're exactly right. There's an independent panel for pandemic preparedness and response that took a very critical look at the global response to the pandemic. And, just to quote one of their lines, they said the COVID-19 remains a global disaster. Worse, it was a preventable disaster. And so there were really missteps all along the way. I think what's really saved us is the fact that we are able to now have multiple safe and effective vaccines that we can deploy relatively soon into this pandemic. But in terms of what went wrong, I think, an efficient pandemic response requires really good and strong global leadership at the national level. It requires resources in order to combat the pandemic. It requires accurate data and data transparency. And fourth, it requires really protecting the vulnerable. As all disasters do, this pandemic has really highlighted inequities and vulnerable populations, both within countries and across the globe.
And unfortunately, another sort of clink in the chain there was that we saw a lot of politics getting involved, which also disrupted how fast or how much certain countries responded. So then how can health officials really prepare when you do have some administrations who have very different ideas about perhaps the seriousness of a pandemic?
Yeah, so I think a number of steps can be taken to try to mitigate the next pandemic. But as the independent panel points out, there have been 11 high-level panels that have issued recommendations since just the 2009 H1N1 pandemic, and a lot of these recommendations have not been implemented. So first, we definitely need planning and preparedness for the next pandemic, but that's insufficient. We need the commitment of the resources so these plans can be implemented. And again, it comes down to leadership at the national and global level. I think we need to do better to empower the World Health Organization to be more independent, to be able to take a stronger stand, and to be able to act very swiftly in the face of an emerging pandemic.
And we have certainly seen that this challenge during COVID that has been raised is also the inequity, as you mentioned before, between some of these wealthier countries and poorer countries getting access. We actually had UN Secretary General Antonio Guterres making the point that COVID-19 cannot be beaten one country at a time. So when you think of COVAX and other groups, how can they manage that given the recommendations?
Yeah, so it requires very strong global leadership and partnership, and the COVAX facility, as part of this broader accelerated access to COVID-19 tools, the ACT Accelerator, of which there are multiple global partners, that really provides the mechanism to get not just vaccines, but diagnostics and therapeutics equitably across the globe. But we need the wealthier countries, and particularly those countries now that will be having an excess supply of vaccines, to really contribute both financially and in terms of commodities such as and vaccines and the supplies needed to make the vaccines. The global community really needs to come together. We've seen a lot of kind of nationalistic responses to the pandemic. And as you said, this really needs to be a global response. And as many people have said, none of us are safe until everyone's safe.
So then what should global organizations do? How do you get everyone on the same page on this?
Yes, well, you need to, I think, first just have everyone realize and recognize that they can't do it by themselves. That if they even if a country can take care of its own population, they're going to be a constant threat. There's going to be a constant risk of importations of the virus, and potentially even viral variants that can escape the protection afforded by our current vaccines. And so that's part of it, is just recognizing that this is in their self-interest to fight the global pandemic, but also having that strong leadership, whether it comes from, the G7, the G20, the WHO, which obviously has the expertise, and really empowering those organizations to take the lead in fighting the global pandemic and leading other countries to do so.